Okay, so next let's go on to hypothyroidism. Okay. First off, if somebody's coming with hypothyroidism, what symptoms are they going to have? Exact opposite of hyperthyroidism. They're going to be sluggish, right? They're going to put on weight. They're going to be constipated. They're going to feel numb, right? Everything is going to be very suppressed, right? And they're going to have weight gain and loss of appetite. That's what you're going to have with hypothyroidism. So when you think of hypothyroid state, what's your best initial test to suspect?
TSH.
TSH. Wonderful. That's easy. Okay. You get your TSH and your TSH is going to be high. It's going to be elevated. Okay. What's your next best test? You are going to get free T4. Okay. Would you check for anything else? Would you have a role on checking for T3 here? No. You never check for T3 in a hypothyroid state. The reason is T3 is always kind of preserved when it comes to a hypothyroid state. So all you're going to play with is going to be your TSH and your free T4. And you would expect your free T4 to be low. Right? Okay. So once you've clinically suspected somebody of having hypothyroidism, what's your next step? What are the causes why somebody would have hypothyroidism?
Iodine deficiency.
Good. Worldwide, globally, not in the US, globally, your reason is going to be iodine deficiency. In the US, we don't have that problem. Why? It's fortified into all the salts, and that's why you actually get all the iodine you need. So what about in the US? Since we are here, what is the number one cause here? Huh?
Thyroiditis.
Thyroiditis. But which thyroiditis? Hashimoto's thyroiditis. Hashimoto's thyroiditis. Why does that happen? Okay, so when it comes to Hashimoto's is your main reason for developing hypothyroidism. And that one, how are you going to treat? You want to give them levothyroxine, right? What is your calculation of dose for levothyroxine? Most of your other inflammatory thyroiditis, are you going to give them levothyroxine? No. Why not? Okay, that's hypothyroidism. Now, next important thing is, what's the severe most thing that can actually happen with hypothyroidism? Mixed edema coma. How you diagnose mixed edema coma? Now remember, thyroid storm, I told you, it's a clinical diagnosis. What about mixed edema coma? So these patients are going to look comatose, right? They'll be hypothermic, they'll have hemodynamic compromise. But here, do you need TSH and T3 to diagnose and T4 to diagnose? TSH will be elevated, it'll be really high, but your T4 has to be low. So you must get labs here. TSH and T4 are important for diagnosis. It is not just a clinical diagnosis here. You do need labs. Okay. So once you diagnose this, how are you going to treat them? First off, where are you going to treat them? Location. Not on the floor? To know. Now, when we talk about subclinical hypothyroidism, right? What would happen? You're not producing thyroid hormones, right? So what would happen to your TSH? Supposed to be high. So TSH will be high and your T4 is going to be normal because that's why you call it subclinical. So when you think about subclinical, your T4 is typically normal in both ways, right? It's the TSH that's changing. So here, because it's hypo, TSH will be elevated. So at what point do you say, I am going to treat my subclinical hypothyroidism? What TSH number? And also remember, whenever you give somebody radioactive iodine, like if it's a female and they're getting radioactive iodine because they had a multinodular goiter or a toxic adenoma, those patients should not get pregnant for the next 6 to 12 months. That's another important point to remember as well. Okay? Okay. The last thing I would just want to talk about in the realm of thyroid is whenever a patient comes to the hospital and they're sick, we have this habit sometimes of ordering TSH and T4. We should be doing that or not doing that? Not doing that. Why? Because you have something called sick euthyroid, which is now called non-thyroidal illness syndrome. Okay? The moment you get comfortable with the title, what do? Change the name. Just to make you confused. That's all the intentions are, nothing else. Okay? Non-thyroidal illness syndrome. So when you think about non-thyroidal illness syndrome, what happens? Why is this happening? Let's go from the top. Thyroid releasing hormone will go down. Next, can you order to say, okay, we're dealing with a non-thyroidal illness syndrome. What do you get here that will actually be elevated? because it preferentially converts your T4 not to T3 but to reverse T3. If somebody's taking levothyroxine and that's the reason for the patient's hyperthyroid state, what would you get? Thyroglobulin, right? Thyroglobulin levels are going to be low. Those are two zebra questions they can potentially ask you. All right, and that is thyroid.